Hey everyone, this is Dr. Hansen from Dream Dental. Due to the high demand, we are going to be talking about cost today for the All-on-4, and I will be giving you price ranges.
Bingo.
All right, well, so probably the number one question we get is, what is this going to cost me? And I know we're on the internet too, right? We know that this is such a frustrating pain point. No one wants to tell you exactly what it's going to be. And we try to explain why that's the reason. We're going to do our best today to give you a really good range, ballpark, and then explain things that might increase costs, things that might actually decrease costs, reasons that the cost changes. So All-on-4 is it's really a complicated thing that we're trying to accomplish. The surgery is complicated. There are a lot of variables in how the surgery goes. The restoration phase, there's a temporary phase and then a final phase. And a lot of things have to be taken into account, and there's a lot of steps, right? And if we start wrong, we can end off course. And keeping right all along the way takes a lot of attention, but it's prone to difficulties and obstacles, so that we can.
No one's the same. And no one is the same.
Oh, that's right, yeah. Plus, no one is the same. And so giving just a flat number is really hard to do. We're going to do our best to kind of make you feel better about this for once. What does it cost to have All-on-4? So the first thing, because many of you may not be in our neck of the woods, we're here in Salt Lake City, Utah. One of the highest population of dentists and dental care going on here. It's really at the forefront, I believe, in dental technology and dental implants. A lot goes on here. But depending on where you are in the country, or even the world, price fluctuates tremendously, right? So I know places in Florida, for example, that to have just one arch, right? So we talk in terms of arches. We talk about like your upper arch. That means doing your upper teeth with All-on-4, or your lower arch. That means doing your lower teeth or your lower jaw with All-on-4 and getting new teeth. So we tend to talk in terms of arch. What is the price per arch to have All-on-4? If you're doing both arches or you're doing a double arch, right, the cost is twice, obviously. So I know places in Florida, for example, where to have a single arch of All-on-4, I know places in Florida where to have like a single arch of All-on-4 implants and teeth done, it's around $35,000, $36,000. And so to do both arches, you're pushing, $72,000, $73,000, $74,000, and I'm sure plenty of you people are hearing that and thinking that's just crazy. That certainly is probably on the higher end of things that I've heard about when we're just talking ballpark ranges. In Utah, where we are, Salt Lake City, and really the whole Wasatch Front, that's kind of what we call the major city and metropolitan area here in the Salt Lake area.
Let's just step back.
Okay.
Call it Salt Lake City.
Okay. In Utah, I'm sorry,
Just call it Utah.
yeah, okay. Here in Utah, our price ranges, I gotta say this without hesitating, or they're gonna say,
How about, what are some other areas that you know of?
oh yeah, what are some other areas?
Because you just did Florida.
I know, just Florida. I talked like, oh yeah, okay. I know.
What about Mexico?
I don't actually know Mexico. Mexico's
Like
less.
$8,000.
$8,000 an arch, right?
Yeah.
Man.
Like Tijuana,
Maybe I'll say 10,000 an arch or something,
Yeah,
and just say,
yeah.
but it comes along with, you
do that.
have to travel, and there's not as much recourse if something goes wrong, because do I put that in Mexico? The judicial system, it's hard to just walk and get a lawyer to,
Well,
I guess you shouldn't bring that into it. It's just, you have less control and less certainty because there's less regulations in that country.
yeah,
I don't know.
Brian's already talked about Mexico.
He has, right?
Yeah.
Why don't I say, whereas over in California,
Yeah.
I know, because I know one in California.
Yeah, do that.
Okay. Whereas over in California, say the Central Valley of California, I know doctors there that they're more on the $28,000, $29,000 per arch to have All-on-4 type of care done. So it can range a lot, certainly. Here in Utah, we are proud to be probably the most, I don't know if I want to say the most competitive.
One of the most competitive.
Yeah, okay. Here in Utah, we are one of the most competitive places in the United States for dental care of all sorts. Our ranges here they start right around 20 and can be pushed maybe upwards of 25, and so $20,000 to $25,000 per arch is a really good starting point for just the process of thinking, what is this going to cost me, okay? And then, of course, that can vary depending on individual situations. So that's kind of our first ballpark, right? So
what's the differences between, if they're going to get any differences, so make that very clear.
mm-hmm.
Differences in material arts, just
Yeah.
very clear, just
Yeah,
in one
yeah.
sentence. And there is no difference between.
Oh yeah, that's right.
Okay.
That's a good point. Can I just start saying that?
Yeah.
And you'll just cut me into that. And there is no difference in outcomes, materials used, the implants, right? We all have access to the same materials. I would even make the case that a place like Utah, being as advanced as it is with dental technology, certainly dental implant technology, we're at the forefront, if as much as anyone else, really. We could make that case, absolutely. Okay.
Perfect.
Okay, so let me start to break it down for you a little bit. And I'm going to talk to you in terms of just certain situations or common situations we find people in. So someone who has no teeth, who has been in a denture, is going to be more, let's see, how do I want to say this? I don't want to sound uncertain, you know what I mean? I don't want to be like caught thinking in the middle of my sentence. I know, but let's see. Okay, so someone who has no teeth can be on two separate spectrums in terms of difficulty and easiness of accomplishing, the all-in-4 for them. Someone who has lost all their teeth, maybe been in a denture for just a year or two, they tend to still have quite a bit of bone. It tends to not be as, let's see.
Gets murky fast.
It does, yeah. I don't want to introduce way too many ideas. I just want to give them some concise things. So let me try it again.
What are you trying to accomplish?
I'm just trying to say, so somebody who has no teeth, right, but it hasn't been a terribly long time,
Okay.
they tend to be easier,
Okay.
and they're going to be on the lower end of that 20 to 25,000 spectrum. Someone who's been missing teeth and been in denture for a long time, they often will have very little, if any, bone, and that can get much more expensive because it's a lot harder to find where we're going to place these implants.
That was the window that you're talking about.
Yeah.
Okay.
So let me start with that. So probably one of our most common patients that we treat here is someone who has already lost all their teeth and is in a denture. This is the most common all-in-4 candidate, and we treat them a lot. They can sort of be of two different types, though. So someone who is in a denture, but has only been in that denture, has only lost their teeth, and it's only been maybe a couple of years, they tend to have more bone, and it's just much easier for us to accomplish the work. We don't have to take any teeth out, right? That can complicate it. The bone is still there because wearing a denture causes bone loss, but it's over time, right? It's not immediate. So someone who's only been in a denture for a short period of time, it's a much easier case. They're going to find themselves on the lower end of cost, down to that 20, sometimes even in just, the right situations, possibly even a little bit below that per arch on their cost. Someone who's been wearing a denture for 20 years or more, or sometimes even 10 or 15 years or more, they can have quite a bit of bone loss. And so we'll look at the CT scan, and if we find that, God, where are we going to place these implants to accomplish this for them? That tends to escalate the difficulty of the treatment rapidly. And as the difficulty escalates, it becomes more expensive. A common thing for someone, say, who's been in a denture for such a long time that they have very little bone left in their arch, maybe their sinuses have started to expand too because there's no teeth there to hold it back. Someone who has such little bone like that, they often need what we call zygomatic implants or zygoma implants. Zygoma is the name for your cheekbone, and we do have implants that can actually anchor into those. They're longer, they're much more expensive, it's a much more complicated surgery, the risks are different, and the cost on that starts going up quite a bit more. And so patients who have that sort of setup are going to find themselves on the more expensive end of the spectrum when it comes to treatment. So that's just the first example. So someone who's without teeth and in a denture, you can see how there's two complete opposite ends of the spectrum because it just depends on how much bone they have, the difficulty of the case. And really, if you're a denture wearer and considering this, my encouragement to you right here and now is don't wait, because there's this window of time where denture wearing has not caused so much bone loss just yet that it makes your case extremely difficult and much more expensive. If you're considering this and you're a denture wearer, you really need to get on the ball within the first handful of years because things change pretty rapidly. The main things are bone loss, and if we're talking about the upper jaw, the sinuses, we have sinuses all over our facial skeleton, but the main ones that we feel when we have like a cold and a stuffy nose are on the sides of our nose in the upper jaw. Those expand throughout our life. And when you remove teeth, those expand even more. And it causes bone loss. So I would just encourage you strongly to take the opportunity, seize the time that you have, don't waste it. There's a window of opportunity where All-on-4 for you is going to be much more predictable and on the less expensive range of things, down towards that 20, possibly even a little bit less, depending on how easy the case can be. So that would be our first set. So moving on now, the next set of patients that we see have teeth still. Maybe not all of them, but a few of them. And teeth can complicate doing an All-on-4. The reason being we have to remove those teeth, of course, to place dental implants. Now, someone who has teeth that are maybe broken down and they're ready to get them removed, but maybe there's not a lot of infection around the roots of those teeth, that jawbone in that person is going to be a lot healthier. Infection is an acidic thing, and it causes bone loss because bone is made of mineral. And so an infection tends to be acidic. It causes bone loss. If you've ever seen an x-ray of someone who's had an infected tooth, a lot of times there will be this big dark spot around the root of it, and that's showing us bone loss in that area. And we can't place implants where there is no bone. So someone with teeth that maybe they're all broken or there's trouble with them enough that they're ready to have what's left of them removed and move on to the All-on-4 procedure. Someone with less infection, someone who's sat around with that for less period of time, that's going to be easier it's going to be easy. That's going to be easier for us to remove those teeth, place dental implants that are sturdy, healthy, in good, healthy bone, and help us accomplish this treatment without complications. Someone who has maybe had broken teeth.
Let me have you just
Okay,
start again.
sure.
There's some noise.
Yeah, those jerks. Should I start with the with teeth again?
Yes.
Okay. The next.
Oh, sorry.
You're all right.
Go ahead.
That's right. The next category of patients are people who have their teeth. Maybe they don't have all of them, but they've still got a handful of teeth left. They're just finding themselves ready to have those removed and move on to the All-on-4 type of care.
I've actually only got 5 minutes on this card.
Oh,
How
yeah.
much-
Okay.
How much longer do we have?
I think I can get it. I think I could get it. Yeah, yeah. I'll move fast. It'll be a good lesson. The next group of patients that we treat the next group of patients we want to talk about are people who have teeth. Maybe they don't have all their teeth, but they've got a handful of teeth. They're just to the point where those teeth are not savable, and that patient's ready to have those removed and have the All-on-4 procedure done. Again, this goes back to time. So people who have had broken, decayed teeth for a long period of time, they tend to have chronic infection around those teeth, and infection causes bone loss. When we remove those teeth, that makes it a lot harder to have implants placed where we need them. It complicates the case, and so it makes it more expensive. If you're more recently, putting up with teeth that are failing and you're ready to move on and get them out, but it hasn't been so long that you have infection rampant around those teeth, that's much more predictable because the bone's going to be healthier. It's going to be easier for us to get those teeth out and treat you and have a more predictable case. And so you'll find yourself, again, on the lower end of the cost spectrum if you have less infection around those teeth. Whereas if you have more infection and it's been a long period of time, we tend to find that those are more difficult cases and they require more materials or more time, and that makes your cost go up for sure. The next set of considerations that we have to make are bone density. So traditionally with the All-on-4 procedure, we're trying to give you dental implants and a temporary set of teeth in one day. We're attaching that the same day. That's the beauty of this. You get to walk out with a new smile. And it's temporary, but it's still beautiful and an exciting start to the journey to having this done. Bone density comes into play here. So the more dense jawbone is, the more stable our implants become. The less dense, obviously, the harder it is to get stability on our implants. We have pretty good methods of getting implants stable. It is not very commonly that we are not able to give someone an attached set of temporary teeth for the day. But that's a big deal. So someone who has extremely dense bone, it's much easier for us. It's much more predictable. We know those implants are going to be stable and there's going to be less obstacles and they're going to be a less expensive case. Someone who has not as dense bone is really suffering with that. We see this a lot in the upper jaw. The upper jaw tends to be much less dense. That can be very challenging. Sometimes we have to call on different types of implants, zygomatic implants, pterygoid implants, or implants that go at the back of your jaw. Things like that in order to accomplish what we're trying to accomplish for you, and that can increase your cost and put you higher on that ballpark range, you know, from the 20 to 25. Another thing is sinuses. So we all have sinuses that are in our upper jaw, and that gets in the way of putting implants in. Typically we stay in front of those, but if you have sinuses that have spread and gotten so big because it's been so long since you've had teeth, your sinuses can actually get quite a ways forward, and the more bone those sinuses remove, the harder it is for us. So sinus growth and the current state of your sinuses can complicate your case and make it less expensive or a little more expensive. The next one really is just going into specialty implants. So if you've researched this topic a lot, if you're watching this video because you've researched a lot, you probably have come across the word zygoma or pterygoid maybe. Different types of implants. Most people know dental implants can be placed just in the jaw where the teeth once were, but we also have implants that can be placed and anchored into different parts of your facial skeleton, which maybe that sounds a little scary, but it's been around for quite a long time. We use those in extreme cases where the bone is so bad or the bone loss is to such an extent that regular dental implants won't work. When we have to use those special types of materials, that can complicate surgery and it can make your cost quite a bit more. So again, I would say here in Utah, really to recap, we really feel that the typical range for this type of procedure is 20 to 25. But again, all those things I just went through can put you up to the higher end of that, perhaps even over if it's a much more difficult case. It can put you down to the lower end of that, perhaps even less if it's a much easier case. If you're getting 2 arches done at one time, because that makes us more efficient, we're also able to drop the per arch cost a little bit lower if we're having 2 arches done as opposed to just 1. So many things to consider. I hope you really understand why. I wish we could just give everyone an exact cost for what it would be for them over the internet or over email, but we can't. So please, if you have any questions with this video, again, leave them in the comments. We know this is a big topic and a point of frustration. We want to interact with you, but thanks for watching. We'll see you next time. Did I make it, man?